Good evening and welcome to IHW Council's special web series on cancer care, New Normal, Same Cancer. I'm Anisha Nayar Dhawan, your host for the show. The one thing that COVID pandemic has taught us is that taking care of our own health and well-being is in our hands and we have to take full responsibility for it. The fear and anxiety of keeping oneself safe during the pandemic has taken a toll on many of us. But now we have to rise above the fear and reconnect with our bodies because cancer does not wait. Cancer hasn't taken a vacation because a pandemic is on. In this new normal, many cancer patients have fallen back on their treatments and new patients are coming at an advanced stage because of the reluctance to visit a hospital. With this series of web shows, we want to say don't wait, contact your doctor, get checked, avoid contact, not treatment. Yes, this is possible and it's imperative. On our show today, we will discuss lung cancer, which is one of the most common cancers in India, and the incidence of the disease in our country continues to grow. According to the Gurugram 2018 report, lung cancer is ranked fourth overall amongst the various types of cancers in our country. In our country, where smoking is a way of socializing and air pollution is rife, it is no surprise that the prevalence of lung cancer is higher than the global average. However, a large number of lung cancer patients in India are non-smokers. So, why are more non-smokers being diagnosed with lung cancer? Why are the number of deaths from lung cancer far higher than those of colorectal cancer, prostate cancer, even breast cancer? Quitting smoking is a sure shot way to prevent lung cancer. But for non smokers, how can one reduce the risk of lung cancer? Now, having wrong notions about the disease, its reasons, and depending on unscientific explanations can lead to delays in diagnosis and hinder the treatment decisions as well. In this series, we are welcoming on our show oncologists, cancer survivors, and experts to talk about their experience and the communication strategies that can help dispel myths and encourage people to seek medical advice and support in a timely fashion. This show is supported by AstraZeneca. Please welcome our esteemed panelists who are joining us now on the show. Please welcome Dr. Arvind Kumar, Chairman, Institute of Chest Surgery, Chest Onco Surgery and Lung Transplantation at Medanta Hospital, Gurugram. He's the founder and managing trust of Lung Care Foundation. Please welcome Dr. Vivek Tomar, patient advocate, George Talks and Speaker International Patient Advocacy Award 2018. Please welcome Dr. Amit Ratan. He's a consultant medical oncologist in Head Department, Manipal Hospital, Bangalore. And we have with us Dr. Srinivasan Santhanam. He's a lung cancer survivor who's also joining us. A warm welcome to all of you gentlemen on this show. And we are here to discuss a very important issue of lung cancer. Why we are discussing in this cancer care series different types of cancers is because even though people know about it, sometimes they are, earlier they used to be afraid of it. They were in denial, and hence they delayed the treatment. Now there's this fear about stepping into a hospital, and the delay is happening, and the delay is the worst thing you can do in your cancer treatment. Dr. Kumar, have you noticed that you're seeing more patients of lung cancer now in advanced stages? Could this be because of the fear of stepping into a hospital?
Sorry, actually, I missed the question. Could you just repeat it?
Dr. Kumar, in your recent experience, are you seeing lung cancer patients coming to you rather late in their diagnosis, in their stage of the disease, because they are afraid to step into a hospital?
Yeah. First of all, thank you very much for organizing this show. I think it's a very, very appropriate topic that you have chosen. And lung cancer being what it is and the way it is killing people, I think it's a very important subject within various cancers that you have chosen. Now, coming to the question, the answer is lung cancer, as it is used to be diagnosed very late in the stage of the disease, for the simple reason that many times patients do not have any symptoms in the beginning, or the symptoms are very non-specific like cough and sometimes blood in the sputum, which are often the same as occurs in tuberculosis, which is very common in our country. And a lot of these patients many times are initially treated as tuberculosis. So because of variety of reasons, a large number of these patients would present in an advanced stage by the time they actually reach the doctor and are diagnosed. So this was already happening in the pre-COVID time. But in COVID time, because of the various other logistics and other reasons, there has been a slight increase in the number of patients who are presenting in this late stage. So it already used to occur in late stage, and now it's slightly increased because of the COVID factors, which we actually saw more during the first 7-8 months.
I think Dr. Kumar is going through a rough patch, and we are having a little problem in hearing what he's saying. We'll come back to him. Dr. Kumar, we'll come back to you. We cannot hear you clearly. Dr. Ratan, what are you seeing? Like Dr. Kumar was saying, this disease doesn't have very specific symptoms, similar to symptoms of TB. And patients were in any case, being diagnosed at later stages of lung cancer, which impacted their treatment plan, their prognosis, and the outcomes. Now, I read somewhere that the statistics of lung cancer being curable in our country is just 15%. Is this true? And, we are trying to tell people that, please don't wait. If you suspect something, you know your body, don't wait. What has been your experience during this COVID period, Dr. Ratan?
Yeah, I agree with what Dr. Arvind was saying. Most of our patients, I would say at least 75% of our lung cancer patients which we see are in stage 4. And that's the way it was even earlier. So we were seeing more and more patients in advanced stage. Only about 15% patients were in the early stage where we could potentially say we could cure them. But unfortunately, even in COVID, even those patients who had symptoms, they stopped coming to the hospital because they were scared. And they're coming in a stage where the performance status has deteriorated, where you can't do much. And that's been the unfortunate story of COVID. But I think in the last few months, looking at the whole situation, India is going to... A lot of people now are coming back to the hospital, and a lot of people are coming in with symptoms. So we are picking up lung cancer much more, but unfortunately, the story remains the same. It's 75% patients still are with stage 4 lung cancer.
Right. Dr. Kumar, sorry, we couldn't hear what you were saying at that time. You were saying that, lung cancer diagnosis in any case was taking place quite late because of non-specific symptoms, and COVID only exacerbated the situation. Now, what's your advice to patients? I know my body, and sometimes I have a cold and cough, and I also think it's a regular cold and the cough. And if it stays for too long, then you feel, sometimes it just stays. What can patients do? We want to increase their awareness, but in the end, it is a doctor who will diagnose, right? And I'm too afraid to go to the doctor. What to do?
So the answer is that, there are a few myths which need to be busted regarding this. And the biggest myth which even doctors suffer from is that it occurs only in smokers. When I started my practice in late 80s, 95% of lung cancer that I used to see at that time used to occur in smokers. And if I see a non-smoker with lung cancer, we used to worry, why has this person developed cancer? We analyzed our data in Gurugram Hospital 2 years back, and we found that in the last 6 years, 2012 to 2018, that I was in Gurugram Hospital, 50% of my cancer patients, lung cancer patients there were non-smokers. And I was astonished to see that data, that 50% are so-called non-smokers. So I thought maybe there is some kind of a recording bias or some error. And I checked up with my colleagues across various cancer centers across the country. And I was horrified that similar findings were being observed by them also, 5-10% up or down as far as numbers were concerned. In fact, one of the hospitals in Delhi said that their numbers are actually 60% non-smokers. So one major change that has happened is that it is occurring now in smokers as much as in non-smokers. We have seen a decrease in the peak age. So earlier we used to see patients in 50s and 60s, and now we are seeing majority, our peak age now is 40s. And I'm sorry to report that 8% of my patients today are in 30s. We are seeing 40% of our patients to be females. So, you know, the old description that if you are a chronic smoker, you are 50 plus, and if you are having a persistent cough, you're likely to have lung cancer, that is now becoming not important. And therefore, we have to be more and more vigilant, because we are seeing it in so-called non-smokers, we are seeing it in women, we are seeing it in younger and younger people. So the message I would give is that if you have a persistent cough lasting more than few weeks, which doesn't go away, please do get a chest x-ray done. And the message also needs to go to doctors that if you see a patch in chest x-ray, in India, everything is considered as tuberculosis unless proved otherwise. It's no longer true. We are seeing a lot of non-tubercular causes also, and therefore tissue diagnosis or some kind of a confirmation of the diagnosis before you label somebody as tuberculosis is vital in today's environment of changing demographics of lung cancer in our country.
Right. So we are going to discuss how doctors can help the patients more, what is leading to this increase in non-smokers coming up with lung cancer. We're going to talk about all of this in more depth during this conversation. But first, I want to come to you, Dr. Kumar. This is the reason why we're having this show, because we want to break the stereotypes. And, you know, the stereotype is he smokes, she brought it out on herself. And it is very cruel to say this, because now it is not even true. Like Dr. Kumar is saying, even non-smokers are getting it. So we, first of all, want to break the stigma, saying that, you know, it is not only smokers who get it. Plus, we have to reinforce, why would you bring it onto yourself? Stop smoking. Stop killing yourself. Isn't that true? Dr. Kumar, I request you to unmute yourself, please.
Okay, thank you. First of all, thank you so much for having this session, as Dr. Kumar and Dr. Ratan says. This is a topic which has truly unmet medical need, but also unmet awareness and a lot of misconceptions. Having a patient advocate and practical experience is very important in such forums, because that humanizes the cancer, that humanizes the problem. So let me humanize this. How I connected this one, and that gives that humanization part, that my wife, my late wife, was diagnosed at the age of 28 with stage 4 lung cancer metastatic to brain, bones, ovaries, adnexia, abdomen. With my son was 3 years old, and she was never a smoker, and she has a cancer which doctors know, that ALK lung cancer, which usually happen to non-smokers and the young people. And she was given 6 months to live. She went into coma within 6 months. There was no precision oncology medicine at that time in India. And she became the longest survivor in India. She survived 7 years. She's in her son's 7th birthday. She participated in 7 clinical trials, and we are the one to bring all the ALK medicine in India. So that's how we are connected, and that's how we became a patient advocate at Global Panel. We are also the first lung cancer patient support group for ALK that we created. Now, coming to the part you mentioned, so like my wife's case, and there is, as Dr. Kumar study, after Dr. Kumar study, there is a report in World Cancer Report 2020, which suggests that in India, majority of the lung cancer patients are non-smokers and women. However, this stigma is so much. When we, as a patient advocate, my wife started to go despite her treatment, we were abused. we were taunted, we were trolled on social media and everywhere saying, you are lying, you must be a smoker, your parents must have smoking. So that's why even you hardly see any lung cancer patient advocate, because we have to suffer not only the disease, social stigma, but it is also the fear which is not getting us the right treatment to us. The other part is related to the this stigma and treatment. Because of this stigma, lot of research are coming, lot of in breast cancer month you would see pink light at Gateway of India, you would see pink light at India Gate, but in lung cancer awareness, have you seen any light? Breast cancer and not any heart failing that become celebrity type. There are people who just have a ribbon and say donate, but when you come to the lung cancer, because of this stigma, they started to say smoke, and that leads to more and more deaths, because that means there is no investment of lung cancer in screening in India. I would challenge if any of us would say, okay, we have seen any advertisement from government on lung cancer screening, though from 2018 a global lung cancer screening program is approved, which suggests lung cancer could save 61% of life in women cases. So there are studies, but we are not seeing. So there are huge gap. But I would take a pause with this initial comments.
Right. I'm very sorry for your loss, Dr. Tomar, and my heart breaks to hear the treatment that you received. And we keep saying there's no stigma attached to breast cancer, but to cancer. But I'm sure it's easier said than done. Dr. Santanam, Dr. Tomar's story is very heartbreaking, but you're with us, and we want to hear your story. How did you come to know you had lung cancer? Did you used to smoke? What was your episode like?
Having heard Dr. Tomar, I feel that I'll have to now wait for another 4 years to say that I am one of the longest surviving lung cancer patients, having heard that his wife lived for about 8 years, despite the traditional treatment she had undergone those days. I am in the safest hands of the medical profession, particularly like Dr. Dhawan here in Manipal, earlier with Dr. T. Raja of Apollo Hospital, Chennai. So my journey is now in the fifth year. And as again mentioned by Mr. Tomar, I am a teetotaler, non-smoker, non-alcoholic drinker, no other vices. In fact, I used to feel, in fact, my children, my friends and others used to cut joke on, you fellow, you should have taken one of the vices. You could have saved yourself from this problem. It's a joke apart. I am a teetotaler, and I had a good disciplined life. And as a true Hindu guy, I used to do all my rituals and very religious minded, and taking food at home. Of course, in the last few years, only the hotel food, all that are very easily coming to us. Otherwise, I was homebound fellow, taking even for my office home food for lunch and all that in those days. And I have traveled extensively throughout India and lived somewhere abroad also for my share of work. These are the occasions when I had taken food outside. Otherwise,
right. Dr. Santanam, can you tell everyone where are you based, and can you tell us what were the symptoms? How did it all start for you?
I am technically I have my home in Pune, but now that I am have undergoing treatment for lung cancer with Manipal Hospital in Bangalore, I am with my third daughter. I have got 3 daughters. I am with my third daughter here in Bangalore at present. And of course, I'm shuttling from Bangalore to Chennai, Chennai to Pune, Pune to Bangalore, Bombay, Mumbai, and all. Where my relatives and daughters are staying. but for treatment I'm taking here. The symptoms I had was, it was June 2016. I had cough. This is typical. Continuously for about a month I was having cough and phlegm, and every day, I think about 10-20 times I used to spit out this phlegm and then coughing. I was in Pune. Then I had my doctor, a family doctor for about 15 years. One doctor, my story is from AR to AR. He was Dr. Avai Raut. He was a cardiologist in Mumbai. So I had a treatment there with him. He took an X-ray, but as was mentioned, it was diagnosed as simple cough. It was ignored. But providentially, my other child, my Bangalore daughter, sensed that there was something more than the problem.
Simple cough.
Yeah, she called me to Bangalore. I was taken to Dr. Padma Sundaram of Manipal Hospital, where looking at the X-ray, she immediately said, yes, no, it is not a cough. It is not a simple cough. You have a tumor. In fact, he asked me to sit out, feeling that I might break down. I was not. I am a little brave fellow. So she was told that I am now, I think, having cancer, a tumor. Then I was subject to all tests, scan and biopsy, all these things. And then considering my family circumstances and all that, I moved to Chennai to take treatment for my cancer first. Then I checked with Dr. T. Raja. He was the chief oncologist in the hospital. And he subjected me to further tests, and found it was ALK positive. And ALK positive was the one June affected. And he said that unlike other cases, I may not be subject to traditional chemotherapy, where in fact, I got a joke with Dr. Raja. Whenever I lose my hair, he said, no, you will not lose your hair. We are going to give you what is called targeted therapy.
Okay.
He said, what is targeted therapy? He said, this is a medicine. Just like a diabetic tablet, you take this tablet and be with it. Only use it.
Right.
So I just went on like this. So such treatment was totally unheard of. Maybe about 10 years ago it was not there.
Yes, this is what Dr. Tomar is also telling us, that at that time his wife did not have access to these treatments.
Yeah.
We'll come back to you, Mr. Santanam. I want to check with Dr. Kumar first. Dr. Kumar, you said you checked the statistics with your fellow doctors in Delhi, and the incidence of non-smokers having lung cancer was fairly high, 50 to 60%. Was this only in Delhi? Was this being seen elsewhere? What is the reason behind this? Dr. Tomar's story is really heartbreaking. His wife is just 28, a mother of a 3-year-old. What's happening here? Is it our genes? Is it the pollution? Why is this happening?
Okay, so when I said that, when I cross-checked with my colleagues, I said across the country, the figure was same, around 50 to 60%. The highest figure, of course, was from Delhi, but across the country, the figure was above 56%, between 50 to 60%. So let's say little above 50% is the national average, because I spoke to people in all 4 metros and also in other cities. That's number one. Number two, I, with my sympathies with Dr. Tomar for the tragedy, but I just, as I mentioned, that 8% of my patients today are in 30s. And yes, 27 years is the youngest patient that I have seen. This was a 27-year-old girl who actually, the family, she was an executive in a company. The family was actually planning to get her married, and she had a node, a lump in the neck, and she came and we did an FNAC. I thought this will be tuberculosis, but I was horrified when it was reported as one form of cancer which comes from lungs. So my first reaction was that maybe it's a lab error. So I went back and checked and actually got the FNAC repeated because I was refusing to believe that report. But then I rechecked and then I asked for a PET scan and was horrified that she actually had a stage 4 lung cancer. So on one hand, the family was actually planning to get her married. And here I was telling them that she has an advanced late stage of an incurable variety of lung cancer. Now, the reason why it's happening, I have been crying hoarse for last so many years that pollution is taking a heavy toll on our health. WHO has classified air pollution as a carcinogen, which means a cancer-causing agent. If you look at the composition of various carcinogens in the polluted air and you match it with the cigarette smoke, you will find that a large number of carcinogens are actually common. So when we inhale a polluted air, it is as damaging as inhaling cigarette smoke. And there is a study from University of Berkeley which says that in terms of damage to the lungs, 22 microgram per meter cube PM 2.5, particulate matter 2.5 is equal to 1 cigarette smoke. So if you are living in a city which has an average of say 220 microgram as the average of PM 2.5 in the city, and Delhi is very close to that, then you are smoking 8 to 10 cigarettes every day. And mind you, this includes the newborns, the toddlers, the kids, the infants, the kids, the children, adults, and the elderly. So when a newborn is born in a polluted city, the first breath that he or she breathes is the same air. And if suppose somebody is born in the month of October, November in Delhi, when PM 2.5 is 400, 500, the very first breath actually gives that child equal to about 15, 20 cigarettes. And this continues throughout the life. So this is my humble submission that it is the exposure to high levels of these air pollution carcinogens from the first breath of our life, which is responsible for the higher incidence of asthma and other diseases that we are seeing in children. And by the time somebody has lived in a polluted city for 25, 30 years, he actually has been a smoker for 25, 30 years. And this is precisely the reason why we are seeing it more and more in non-smokers, why we are seeing it in women, and why we are seeing it at younger and younger age. And this is something which is being seen across the country because pollution, mind you, is not a Delhi-specific problem now anymore. Delhi gets more attention, but pollution is now pan-India problem. And I, as a lung cancer specialist, attribute this rise in the incidence, this rise in non-smokers, this rise in ladies, and this rise in the younger population to our continued sustained exposure to air pollution.
Dr. Ratan, this is fairly alarming because, I mean, what is the alternative? Dr. Kumar is saying it's not just Delhi. Pollution is bad everywhere. Even in Mumbai and Bangalore, it just doesn't get hyped up. It's bad. And, I can never imagine ladies smoking, but that's what's happening. What do we do in these circumstances? We can't all retire, become aesthetics, and go to the mountains and breathe clean air. There is, at one point, the government who has to realize the problem that unless you fight pollution and unless you demonize smoking, the public health burden of lung cancer is phenomenal. The amount of GDP we will spend on treating cancer is phenomenal. The productivity loss we will have is phenomenal. Now, the thing is, the government may not prioritize this. Then what do we do as citizens of this country, aware of this problem? What can be done?
I think you've asked the $1 million question. I wish there was an answer to this, So the whole situation is such that we kind of so we keep blaming smoking as one factor, and yes, pollution is the other important factor which we are saying is responsible for the lung cancer which we are seeing. But there's a lot of background factors which we don't understand, and that causes a lot of confusion. The whole issue is, if there's pollution, why are females getting much more cancers than the males? In the present time, you're
Smoking
seeing
the same air.
much more adenocarcinomas you're seeing in females than males. Many of these females are homebound. They're not even going out and they're still developing it. So there are a lot of intricacies in this which we don't have straightforward answers to. So I believe I would put it as an environmental exposure, the background, but there is some genetic tendency in the background. There is some hormonal tendency in the background. There could be infectious factors with dietary factors in the background. So the problem is, it's not going to be very easy to pinpoint a cause. So for us, when it was smoking, it was very easy. We could just say it's smoking induced. But now that we are seeing so many more adenocarcinomas, and as Dr. Arvind mentioned, we have so many young females with adenocarcinomas in our clinics. Every day we see younger patients, and we see these young females with adenosines, where they ask us, why are we having it? And I still don't think I have a right answer to answer why they developed it. It is multifactorial. We say, yes, we'll try to look at all these factors, but I don't think there's going to be one answer. Yes, the government regulation for pollution, government regulation for tobacco, no doubt, that's important. But I think a lot of research has to go into other factors, what is there in the background which is causing it. And I think this will only happen with a lot of research which goes into this.
Right. So Dr. Kumar is a little pressed for time and he has to go somewhere. So I will ask Dr. Kumar to give us his ideas. Dr. Kumar, you say pollution is an important component. Dr. Dhawan is saying there could be more because, many women, like what Dr. Tomar also said, his wife was young and, many women are homebound. Men and women both breathe polluted air, but more women have adenocarcinoma of the lungs. Dr. Kumar, what is the way out? We have screening for breast cancer. Can we start screening for lung cancer? Could that be effective? And when do we start it?
So first of all, I would agree with what Dr. Amit said, that definitely I accept. It's not that we are seeing lung cancer more only in females. It's that now we are seeing it more and more in females also. When I look back at my data of late 80s and early 90s from AIMS, majority of the patients were actually males. But when I look at my recent data, I found that 40% of them are female. So it's not that females, even today, the number of male patients is more than the female patient. But yes, the male-female ratio today is much more in favor. There are many more females today than there were, say, 30 years back. So that is one thing, that even today, the overall incidence is more in males, but we are seeing more and more non-smoking females. And I totally agree with Dr. Amit that while I attribute it to a big extent to environmental, and mind you, one more thing I want to tell, we feel that, people who are not smoking are actually not exposed. This environmental exposure in cities is due to pollution, but even in our rural areas, there is a lot of indoor air pollution, which is responsible for the, because of the biomass fuel burning in the house, which is responsible for that. So yes, I agree that there could be genetic factors and other factors also playing a role. Definitely, it's a multifactorial etiology. But pollution is playing a huge role, and pollution is something that we all can act together and try to bring under control, because genetic factors are out of our control. Right. So as far as the preventive aspects are concerned, I keep saying that pollution is a kind of a health emergency, and all of us together. The sad part is that all of us cause pollution, but when it comes to rectification, we are very happy saying that, oh, it's the government's job to control it, we can't do it. Whereas no country in the world has controlled pollution by just government measures alone without people contributing. So I would say that the people have to be aware that this air pollution is killing our present as well as our future generation. It is a public health emergency and we need to do something about it on an urgent basis. And if the government doesn't take adequate measures, I think we have to raise our voice and request them, even force them to take in the interest of our health and our future generations' health.
Right. Dr. Kumar, any word on any screenings that are possible for lung cancer? Because breast cancer has a proper screening process.
Yes.
And what age should you start?
So screening is something which actually has been an area of a lot of debate for all of us. I myself have been toying with this idea of starting this in our hospitals. The problem is that in India, we have a very high incidence of tuberculosis, and lot of us have various kinds of patches. So how does the screening work? You actually take high risk population and you do, they are not patients, they have no symptoms. So this is a normal population, and you do their low dose CT. And then if you find any suspicious patch, there is a protocol as per which you are supposed to investigate by doing a biopsy, etc., to know whether this is cancer. And if this is cancer, you treat it accordingly. The problem is that, of course, this is a speculation. In our country, because of such high incidence of tuberculosis and various other infections, the fear is that we may have a lot of patches seen, and a lot of patients will, not patients, a lot of people will end up having a lot of investigations, and maybe the yield that we will find may be low. Now, I must clarify here that this is just a fear in our mind. As a scientist, I think we should not be going by fear. We should do a study. The only thing is, it has to have a large number of patients, and therefore no single hospital will be able to do a screening study which will have the power to be able to adequately answer the question. We need to have a kind of a national based trial involving many centers. Then only we'll be able to have this answer. In US, it has been proved conclusively. In India, it needs to be proved.
Dr. Kumar, what is the threshold at which you start screening the general population who may not be high risk?
So that is another issue, that in West, they had a very clear-cut patient should be above the age of 55 years. Patient should be smoking more than 25 or 30 pack years. So they were very well laid out criteria which were related to the kind of cancer demographics that they were seeing. In our population, as Dr. Tomar mentioned, when we have patients being diagnosed at the age of 28 years, I say that 8% of my cancer patients, lung cancer patients, are in 30s. Now, what cutoff do we fix? Do we take only smokers? But definitely, somewhere a start has to be made. So I think going by the National Lung Screening Trial criteria that was done in US, we have to take a cue from there, maybe decrease the age by a bit and have that as a starting point and do a lot. The only thing is, it has to have a huge number of people enrolled. They have to be followed up for a minimum of 5 years for us to say whether it is actually benefiting them.
All right. Thank you so much, Mr. Kumar, for giving us the suggestions. Mr. Tomar, what do you feel? You also mentioned globally a screening program coming through. Do you think it makes sense?
Can I sign out if you allow me to, please? Because I have a patient to see actually.
Sure, Dr. Kumar. Thank you so much.
Thank you so much. And thanks to my co-panelists and all of you. Thank you.
Thank you. Dr. Tomar, Dr. Kumar is coming up with very sensible suggestions that we start screening and we do this study on a larger population base, because pollution is everywhere, and much younger patients are being seen in India than elsewhere. As a patient advocate, what would you think? What are your suggestions, since you would have been doing some research on what is happening globally and what can be done in India?
So great question, and let me get some practical figures from the patient community as well as the scientific community. So this study which about the West, Dr. Kumar was mentioning, that is called Nelson study. It has patients, lot of patients, and that suggests that having a low dose CT scan with patients with previous smoking history, even who have left smoking 15 years back, if it has been done, it has reduced the mortality rate of 26% in men and 63% in women. Doesn't that alarming data is reducing the death 63% women? And in India, We are not talking about it. We are not doing it. We still are doing a lot of tests. There are, there are a lot of preventive tests are doing. Every at district level, every district civil hospital has, if not MRI, but CT scan. So it can be done. It is low dose CT scan, and what major proof required. One thing also to correct Dr. Kumar, though it was 55 years since 2 days back, but on 12th of March, US government has been two very important things which is being accepted by the other countries. First, they have reduced the dose age from 55 to 50, and then moving further ahead, knowing because lot of young patients are coming. And the second one, they have started a research that is called not an act, Women Lung Cancer Research and Preventive Act 2021 in Washington yesterday, because of so many women thing. And we are not talking about the research. One more data, in my patient support group, we did surveys. And I will tell you that it is not about the patient and clinical, but it needs awareness at a lot of level. So, for example, Dr. Kumar very rightly said tuberculosis. My wife at stage 4 lung cancer was misdiagnosed and treated for brain tuberculoma for 1 year. By the time her brain tuberculoma, which was brain cancer, from 10 to 32. So that's how things could worsen. So we have to, come up of the awareness at oncologist levels, physicians level, patients level, and government awareness level that it is not about cough. My wife never had cough. In our surveys, 80% of patients didn't have any cough, because a lot of lung cancer goes to brain, and they have some migraine type symptoms, and they say it is migraine or bone or other symptoms. The other interesting thing is, so 40% has wrong diagnosis, and 80% doesn't have the diagnosis until they have other symptoms too much or the misdiagnosis. So my message to is, first one is, we should have to seriously not only think, implement the lung screening program. That may not have the non-smokers, but that could, if reduce the have been previous smokers up to 60%, that is a huge win, in not in terms of the people health, but in terms of the life as well as economy, because it goes billions in treatment. The second recommendation is, there is a term called liquid biopsy, which can be done on any person, which could suggest with blood samples there is symptom, but the cost is currently is 2.5 to 3 lakhs, so even the patients can't afford. So can we work on the mechanism that such liquid biopsy could be done, especially for the non-smokers, or Dr. Amit says maybe in the previous patient history, family history, that could be treated. So there are ways. And
so
the last
liquid biopsy is also, upcoming. It's and as you said, it's expensive. What was your last point? Please complete, Dr. Kumar.
You continue. I will come back. That's fine.
Right. I wanted to check with Dr. Santhanam as well. Dr. Santhanam, my Masi also had lung cancer, and she died because of lung cancer. And what Dr. Tomar is saying was true in her case too. There was a family history of asthma. So for at least 2-3 years, her treating physicians told, "Aapko asthma hai, aapki family mein run karta hai." She got surgery of polyps in her nose done because she was having some cough and, breathing problems. And so the whole diagnosis took so long that she was diagnosed with stage 4 cancer. She got her targeted treatment, but she lived for a few years. Her quality of life was also good, but like many people, the lung cancer mortality rate is fairly high. And you spoke about your family physician who suggested that something more is at play. Do you think that there has to be more awareness amongst the medical community itself? Everyone can't step in and meet an oncologist, right, when they have a cough. So in your experience, what do you think, is the way out? One thing is, I know something's wrong with my body, but I need a doctor to certify it. And I can't walk into a medical oncologist I feel scared to think that I have cancer. So your family doctor told you to take it forward. Do you think there is, this misdiagnosis can be somehow be reduced?
Thank you. I just would like to make it very clear that diagnosis, the cancer itself is having a fear in the minds of a large section of the people, because of the cost of treatment and the chances of survival and quality of life, post-treatment and all that. These are the three factors which are actually threatening and frightening even those who are having symptoms or non-symptoms. I was also having fear that I may not stand the chance of living beyond 4 months, 5 months, because the cost of medication and the pain of this. But the modern technology and modern medication, like a targeted therapy, which I am undergoing now, like a diabetic tablet, I am taking tablet, I am just being with it. I am doing my cycling, I am doing my swimming, everything. Everything I am doing it. But the fact remains, the cost of this medicine is so huge. It's creating a tremendous amount of pressure on each one of us. I am one who has been going through this. I do not know how many millions of people in India can afford to do this.
Not many, Dr. Santaram, because these targeted treatments are not covered by Ayushman Bhavan and Ayushman Bharat scheme, and these are expensive. So my Masi also underwent these treatments, but then, everybody can't take it. I'm only saying, why are we being diagnosed in stage 4? What was your stage when you were diagnosed?
I was, in fact, it was June 2016. By September 2016 or October 2016, when I reached my oncologist, he said I am stage 4. He said that we could have contracted this about 6 months before. That's what he said.
That's what I'm saying. If you were being treated for 6 months, why was it not, at stage 1? Why weren't you diagnosed at stage 1? Why were 6 months spent?
That's the irony of fate. My doctor in Bombay could not diagnose it as a cancer problem. He had put it as a simple cough and all that, treated me with some regular medicines. That providentially I came to Manipal Hospital and met Dr. Padma. And Dr. Padma immediately, even looking at the old X-ray, she said, there's a tumor.
Dr. Santaram, is Dr. Padma an oncologist?
So she was a pulmonologist in the hospital. She diagnosed and immediately said that, it's a tumor that you will have to go through for further process. So that's where I started, but it was already late in my case.
Right. So, Dr. Ranta, what Dr. Santaram is saying is that, cancer itself, treatment costs are very high. He's undergoing targeted treatment, which has good outcomes, better outcomes. But why are people being diagnosed in stage 4? Why are young people being diagnosed in stage 4? In our country, the majority of the population is young. So you will have younger patients. But where is the gap? We have oncologists, we have facilities, like Dr. Kumar said, you got scanning machines in every district. Is there something missing in the medical community itself that seems to trivialize upper respiratory infections and say, TB to sabko hota hai, ye TB hai. Ye kyun ho raha hai aise? Why are we not taking it seriously? Does the medical community also need to be, schooled in treatment and early diagnosis of lung cancer?
Yeah. So there are two levels of problems here. So one is lung cancer itself. When it manifests with symptoms, at least most of the times it would be in advanced stage. That's the unfortunate lung cancer. So if I get a patient who's already coming to my clinic with cough and breathlessness, and I do a scan and find a lung mass, and I find it lung cancer, 80% of these patients will be in stage 4, because that's the nature of cancer. So unfortunately, this is one cancer. So if you look at the data from the West and from India, the same number of lung cancers are there in stage 4 in the West and in India. This is very different from breast cancer. In breast cancer, we find a lot of more locally advanced cancers in India, but in US, you'll find them more in stage 1 and 2. But in lung cancer, the same 75% of patients would be stage 4 in lung in India or in the West. And that's because of the unfortunate biology
nature of the disease.
That's how it is. It's the biology of the disease. But yes, the second level of problem is the level of testing and intervention required. So that is where there is a knowledge gap. We see if you have a cough which is going on, people could think tuberculosis, people think allergy, and just go on and not evaluate further. So this is something that we are trying to build up awareness on. As Dr. Santanam has mentioned, going to a pulmonologist early sometimes picks up, because pulmonologists are very, very attuned to picking up early, and they are very good at it. So they don't sit and delay it and just do X-rays. They do a immediate CT scan. So now the pulmonologist base also is becoming very prominent, and they will help us diagnose it in early stage. Now, patients are not scared to go to a pulmonologist, but patients will not come to our clinics directly with cough.
Yes,
they're scared to come to an oncologist. So I think there is a knowledge gap there. People should not just ignore cough or breathlessness or coughing of blood, think of tuberculosis only. They have to think, the medical examiners have to think this could be cancer, do a CT scan and investigate it early, or send it to the nearest pulmonologist, because they are equipped to diagnose things much better.
Right. Dr. Santaram, you're taking treatment. How would you rate your quality of life? And we're winding down, so what is the thing that you want to, say to our audience, or any suggestions that you may have to either the medical community or the government?
Just about a minute, a small video I would like to share here. Just take you my journey in a very, very short 1 minute, 1.5 minute video. Kindly watch, please. Is it okay?
Dr. Santaram, we'll have to take permission from Himani to do this, because I don't have the rights to do that. So
it's only it's for the panelists to look
yeah,
at.
So you can share it, sir. If you have the sharing rights, please go ahead and share. So I request you to unmute yourself and share. Dr. Santaram, you're on mute. Please unmute yourself and share the video.
My concern is how. Please watch. This is with. Thank you. This is the journey I have. The quality of life is increased.
Yes. So looking at your video, Dr. Santaram, it looks like you've made a good recovery and your quality of life is good. And I would say that, my Masi also took the targeted treatment. She even went to Europe for a 2-week holiday with my mom. And so she also had a good quality of life. But is there any message that you want to give to people watching to be more mindful of their health, or anything that you think that the government can do so that we catch it early and, the treatment is even better in over a shorter duration?
Yeah. My takeaway from this is that this is an opportunity for the organizations run by Mr. Tomar, Dr. Tomar, to take it forward with the government, because it's an advocacy NGO for the cancer survivors. So, two things. One is the cost of medicine. That is very, very, very important. The quality of life is to be improved, but the cost has not come down. It has gone up. We are not able to do it. But you see, suppose I go to a restaurant and take my food, I pay 5% GST. But if I go to I fall sick and go to the hospital and get treated, I pay a GST of 12%. This is an irony. Perhaps this has to be addressed. I sent a message. I sent a request to the Minister of Finance. There is no response. That is the status of the vision. Dr. Rauthan has gone out of the way to help me out. In fact, he had tried a number of occasions to speak with the companies to show concession to the, not only for me, the similarly placed survivors, to reduce the cost of medicines. I think it will have some effect and all that. Then my appeal is that engage in dialogue with the companies for producing these medicines and reducing the cost.
Definitely. So the cost is an important factor.
PPA also for declassifying this from scheduled to unscheduled, because this is a very technical thing on which they are trying to play with. In the Indian context, may not be applicable to other European and all that, where social security system is very strong. Yes, social system is very, very weak for the common man. I'm a privileged guy, but I'm not a sample for the millions of...
No, I understand that, Dr. Santharam, the cost of treatment is...
I am prepared to offer myself as one of the volunteers. If Mr. Tomar, Dr. Tomar can take, or can help if you want. I am prepared to offer my services to be a volunteer in any form which they feel. I can communicate. After all this, I have written my first Kindle book, which has come 2 days before on in Amazon.
What is the name of the book, Dr. Santharam?
Ides of March has come. Ides of March has come.
Ides of March, okay. So for all those who want to know more about Dr. Santharam's study too.
I should thank Dr. Rauthan and my family members, my children, and those who traveled with me all these 5 years. And I know I feel confident that I will live more than...
Definitely. We also hope and we pray that you live long and you live happily and healthily. That is all that we would also wish for. Now we have come to the end of the show, so I'm going to leave the last word with Dr. Tomar. Dr. Tomar, you are doing advocacy, and this is very important. Dr. Santharam is talking about the cost of the drugs. Dr. Amit is talking about so many other factors that could be responsible more than just the pollution, and how we need to investigate this more. We need to have more people talking about it, but along with greater awareness, do you think we will achieve the target of finding it early, so that any cancer, if diagnosed early, is better treated?
So, Anisha, as you have, I think, mentioned earlier in this discussion today, that when you raise your voice, it will be heard later or sooner. So, my few of the messages to everyone. First one is to patient is share your story. Thank you, Dr. Santharam, that you are coming. If you not raise voice, nobody is going to hear. There is no policy for lung cancer screening or that much awareness. That's fine. But if we not speak, it is not going to happen never in future. So be your own advocate, because nobody can better present to you than yourself. The second message is again to patient community is never ignore any symptoms. If there are symptoms, please discuss. If diagnosed early, cancer has cure. Even lung cancer has cure. So the third one is, though yes, my story could be seen as my wife's story, my story, my son's story could be seen as tragic. However, you must understand she was diagnosed at the era where there was chemotherapy. She participated in 7 clinical trials. She survived. She ran marathon at stage 4 lung cancer, metastatic 36 in brain ovaries, wearing a t-shirt that 5 years at stage 4. If I can survive, you can survive. So there is hope. Anyone can survive. You just has to be the right approach, positive attitude, and right treatment. Now coming to the treatment part. For the lung cancer, patient community and doctors has been majority of the know that in May 2020 itself, 6 lung cancer new treatment come, and in 5 years the treatment is 28. So there are treatment. Availability is not the problem. Yes, the problem is accessibility. Ayushman Bharat could be an answer, and we have taken already appointment with the ministry that we are not going to set up, and you are not going to sit up. Just keep asking that all those latest treatment, because as Dr. Shantaram has rights to live, as I have rights to live, a poor person who can't afford one-time meal has equal rights to live. We are Indian and we have equal rights to live. So that needs to change. And then medical community, especially Dr. Arvind, Dr. Kumar, that you are our leaders and you can educate to the doctors who are in rural areas that not aware. I have seen patients given other treatment or tuberculosis. So we look forward to a true partnership, because patient voice cannot be underscored, and we are here together to make this change, and we are going to change this.
Amen, we will. Thank you so much, Dr. Tomar, for those very positive notes on how we can fight this disease and reduce the burden in our country. I'm sorry, we're completely out of time, but I would like to thank all our panelists for joining us today in talking about this very important issue. There's so much to talk about, but we've communicated the most important thing, that we need to talk about this. We need to bring in all stakeholders on the same table and try to find solutions, because if Dr. Santhanam can do it, many more can do it. The access has to improve. Thank you so much for joining us. Thank you for being with us and sharing with us your experiences, your expertise, and your feelings and your knowledge. A big thank you to all of you.
Thanks.
Thank you so much. I really personally thank the Dr. Rautan for having recommended my name for the today's panel discussion. Thank you so much, Dr. Somar and others.
Thank you. So we'll wrap up this show. This was an initiative by AstraZeneca to tell everyone that do not delay your treatment. Cancer is not on a vacation. Seek treatment, avoid contact, but not treatment. So do take your health in your hands. Do be proactive. Do follow us on Facebook to get all the updates on our upcoming shows. And keep sending us your questions. If you have any, we'd like to take them up in our subsequent shows. Stay at home, stay healthy, stay safe, and have a great weekend. Goodbye.